So my name's Diane Barlow. I'm the carer champion for Charlesworth ward at Peter Hodgkinson Centre in Lincoln. Our main role is to keep family members and carers up to date with all relevant information moving forward. Obviously, we need to gain the patient's consent for any information sharing regarding treatment moving forward. However, we are able to share generic information to family members and carers, such as whether they're eating, drinking, sleeping, just the generic information, because sometimes, especially if it's a family that's first time coming into mental health, is quite scary and quite daunting, you know, handing over their loved one to people that they don't know, system that they don't know how it works, etc. And it's just reassuring them, and sometimes it's all about just listening and just, you know, letting them rant to you, you know, of any background information that may be relevant, as you know, that's led up to the admission, and for, you know, to be able to take that to ward rounds as well. This role has been needed for quite some time, because the acuity of the ward and how the ward can be from day to day, it's very unpredictable. Obviously, with it being acute, we do get a lot of very poorly ladies on the ward, and staff really don't have that time like we do as carer champions to be able to spend that time, you know, to just listen to them. And you know, sometimes it's just that they want reassurance that their loved one is okay and that they're been well supported. And even if, you know, if it is a first admission, just about reassuring them maybe on a daily basis and keeping them really involved and updated, where nursing staff on the ward aren't able to do that. And we can take the time to spend with patients as well, gaining their consent and sort of as well getting their feedback, you know, what potentially could have led up to the admission. Being able to spend that time not only with the family but with also the patients. I treat patients and families as if they were my family, and how I would feel that I would want people to treat me or my family if I was in that situation. Don't be afraid to ask for help. That's the biggest. Don't be afraid to ask for help. There is help out there, and a lot of people don't like to be classed or labelled as a carer. A lot of people don't see themselves as a carer. Even just by making a telephone call 2 or 3 times a week, they're classed as a carer. They may be entitled to some additional support, and they can also do a self-referral to Carers First to see if they'll be entitled to a carer's assessment, and that can open many doors to many, you know, they could be signposted to multiple different options of support.